Welcome to the program. I'm your host, Neal Howard, here on Health Professional Radio. Real glad that you could return. We're going to be speaking with returning guest, speaking of returning, Dr. Neal Shore, coming back to talk about the importance of patient-centric treatment decision-making and a little bit about the publication of a very easy-to-understand summary of important clinical data that was just published in Future Oncology. That's a leading medical journal. Welcome back, Neal. How have you been?
I've been great, Neal. Thank you very much for having me back to discuss with you this important topic for patients with advanced prostate cancer.
Well, for our listeners who may not be familiar with you as a contributor, give us a little bit of your professional background, and then let's talk about this data.
Yeah, thank you. So I've been dedicating my career to research and clinical studies to help offer patients and their families additional options and therapeutics to combat prostate cancer. The goals are always to prolong survival, prevent complications of therapy, and preserve quality of life. And that's also in the setting of understanding patients' preferences or their risk-benefit assessment. And that's what I've been dedicated to doing. I'm the medical director of Carolina Urologic Research Center in Myrtle Beach, South Carolina, and I'm also the chief surgical officer for Genesis Care within the United States.
Now, I mentioned in the outset that we were going to talk about some key findings that were published in Future Oncology recently. First of all, what does the data address? What specific condition are we talking about?
Yes, and this is a very important point of understanding for patients and their families. When we have patients who get diagnosed with prostate cancer, and unfortunately we perform removal of the prostate, or we have radiation to the prostate, what we call an active treatment to the prostate gland on diagnosis, there is a proportion of these patients who we don't cure. And we know this when we start to see the PSA rising. And the PSA will go up, and a decision is then made to initiate lowering of the male hormone, the testosterone level. And we've known this is very effective in advanced prostate cancer patients who have PSA recurrence, or what some call biochemical relapse. And lowering the testosterone level with injectable therapies, and now there's a new oral therapy available too, that works for a period of time. But in some men it's a few months, and some it could be even a few years. Mm-hmm. But invariably, the cancer cells are smart, and they find a way to grow despite lowering the male hormone testosterone level. And that PSA level starts going up. When we look at imaging studies and say, well, why is that PSA going up? And we get traditional CAT scan or CT scan testing and bone scan testing, and it comes back negative. We recognize that there are microscopic, undetectable cancer cells that are causing that PSA to go up. And it's only been in the last couple of years that we've discovered and demonstrated a therapy such as darolutamide, which is very nicely described in the Future Oncology publication, mm-hmm. that can now help patients. Slows down the cancer, lowers the PSA, it prevents eventual imaging findings on CT scans and bone scans. But most importantly, it prolongs the patient's survival. It slows down the progression of the disease. Mm-hmm. And in our study, the Aramis trial, which was really pretty cool, it was very well tolerated. And I think that's really important because most of our patients who will require or benefit from this therapy are typically in the older population.
Mm-hmm. Does this population have access to this information to make an informed decision with their healthcare provider about their particular cancer?
So now in the United States, the drug darolutamide, it also goes by the commercial name Nubeqa, Nubeqa, is FDA approved and is now part of our the National Comprehensive Cancer Network, the NCCN guidelines, receiving the top level of endorsement, what we call a Category 1A. Mm-hmm. So absolutely, patients should have this discussion with their healthcare provider.
Were there any unexpected results from the Aramis trials?
Well, initially, in our New England Journal of Medicine publication in this trial, which was conducted throughout the entire world, right? It was a globally conducted study looking at patients who had the rising PSA despite being on medication to lower the testosterone level. And patients were randomized to receive the darolutamide, which is 2 pills twice a day with or without food, as opposed to just continuing on the testosterone-lowering medication. And what we found was these patients had a greater than or about a 2-year improvement before we ever saw radiographic or what we describe as CT scan, bone scan, positive findings. In addition to that, when we looked at some of these more complicated but validated questionnaires in terms of patient quality of life, we found that the drug was remarkably well tolerated, where only we saw a slight increase in their fatigue levels. And so this was really important. And I think that the second really important key finding was not only did it delay by, on average, 2 years before there would be positive findings on imaging studies, CT scan, bone scans, but then ultimately our second New England Journal of Medicine publication showed it prolonged survival and didn't stop patients from having an option for any additional FDA-approved, Medicare-endorsed advanced prostate cancer treatments.
How easy is it for patients to understand the benefits of these findings, and how should they go about getting themselves more informed?
Yeah, knowledge is power, and educational programs like you provide, and then also articles that we've written now. The first author in the Future Oncology article is Karim Fizazi, and the senior author on it is Joel Nowak. And this is a really nicely written, very understandable article for patients to review to understand the benefits of taking a drug such as darolutamide. Like I said, it's pills. It's 2 pills twice a day. It'll slow down not only disease progression, but ultimately lowers the PSA rather dramatically, and additionally prolongs patient survival and doesn't prevent any other therapies in the future. And most importantly, in terms of quality of life, the drug was remarkably well tolerated. And I think that's important. We looked at issues such as patients' ability to process, or what we call cognition. We looked at issues around cardiovascular. We looked at issues around falls and potential fractures. And there was no increase whatsoever in the darolutamide arm versus the control placebo arm in Aramis. So patients need can go on websites and get information. But I think if they're seeing a radiation oncologist or a urologist or medical oncologist, that doctor, their team should be fully aware of this data and have a conversation with patients, as this is really an important option now for enhancing patient care.
Give us a website, Neal, where our listeners can go and get some more information about the Carolina Urologic Research Center, and also about the Future Oncology study that we've been discussing today.
Sure, my pleasure. So this publication in Future Oncology was published online on February 8th of this year in 2021. Again, the title of it is Darolutamide and Survival in Non-Metastatic Castration-Resistant Prostate Cancer, a patient perspective of the Aramis trial. The first author is my good friend and colleague, Karim Fizazi. He actually was the lead principal investigator for the Aramis trial. I was part of that trial and part of the steering committee for that. So that's a really good way to get a hold of this information. And then our website is, Carolina Urologic Research Center.com.
And I do believe another good resource is www.futuremedicine.com.
Yes, that would be great as well.
Great. Well, Neal, always a pleasure, always some great information. Thanks for returning. Looking forward to our next conversation.
Thank you, Neal, very, very much, and thanks for all the great work that you do.
You've been listening to Health Professional Radio. I'm your host, Neal Howard, in conversation with Dr. Neal Shore. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download us SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.